Good morning. My name is Nick Gage, CEO and President of the Morgan Hill Chamber of Commerce. On behalf of our entire team, I'd like to welcome you to the Morgan Hill Chamber of Commerce's Biz Dev series of educational workshops. The goal of our educational series of workshops is to inform and to educate our business owners and consumers on today's relevant topics of discussion that impact them both today and in the future. Now, today, we are excited and pleased to have on our workshop series Clifford, CEO of Geneharmonics Human Health Solutions, and Regina Bilquist, Director of Western Region Humana Group Benefits. Welcome to the workshop, team.
Thank you.
Maybe as a prelude to today's session, Geneharmonics Human Health Solutions and their partners' singular purpose is to assist companies reduce their healthcare expenses while increasing the benefits enjoyed by their employees. Which is not just a lofty goal if one partners with a company with seasoned experience and tangible results, as is Geneharmonics Human Health Solutions. Now, in today's workshop, we're going to take a deeper dive into an affordable premium dental plan option that can dramatically reduce the employer's healthcare expenses while providing the highest quality of care for their employees. So with that as an introduction, Clifford, I'm going to hand it over to you and to Regina.
Oh, great. Thank you. Thank you, Nick. We're really excited to talk about this important topic, dental care and dental plans. You will see that by the end of this presentation, members will see why they should have a Humana dental plan. Many of the employers already are paying for it. They just haven't been told how to enroll. Interesting enough, there are plans that are available for any budget, and we'll get into it post haste. If you would click on that, you'll see that they have PPO plans for any budget. So the next slide, we'll get into a little bit about who Geneharmonics is. We bring 50 years of experience in this employee benefit arena, and we provide leading edge medical and dental plans to all our clients with cost savings. And I'm going to repeat that all clients are receiving cost savings and unmatched coverages for their employees. And that is unheard of today. These things that we present have been designed so that they're not well known, and many of them haven't even seen it before. If you click, you'll see that we are the out of the box brokers, and that we provide things that no one else really is showing. If we go forward now, if you click on that again, you'll see Regina Bilquist. We're joined by Regina from the Humana to give you some insight about why Humana is the premier dental plan. Also with us in the background is Ryan Rysochik, who's also with Humana. In addition, I have one of my staff also in the audience, kimthai, that will be helping many of the members enroll into this program. So Regina, why don't you take it away and tell us why Humana is the greatest?
I love it, Clifford. Hi, everybody. My name is Regina Bilquist, and I am the sales executive for Humana. Humana is a Fortune 50 company that cares for over 17 million total members, with 7.9 million on our dental plans. I've actually been with Humana for over 13 years, and I'm here at Humana because I truly believe in our products. I really enjoy educating the community on what sets Humana apart from our other competitors. We have so many features to our flexible plan designs that are created to put more money back in our members and our employers' pocket. In fact, many of our features are designed for the flexibility and for the savings. When Clifford talks about unmatched benefits, we are so flexible in what we can offer. We offer flexible, rich plan designs and unique plan features. One of the plan features that we offer is for all of our clients, we offer 3 regular cleanings. So every family member, every person in the group would benefit from the 3 cleanings. We offer 4 periodontal maintenance cleanings, so those deep cleanings that are actually quite expensive. They run about $250 per quadrant. We cover those at 100%. We also have many annual max plans, but the ones that we are highlighting today are our $5,000 annual max, plus our extended annual max. And ready for this? Humana offers an unlimited annual max products that has been one of our flagship products throughout the years. Humana plans offer extended annual max, which is a feature that essentially offers unlimited coverage. Once you meet your annual max, Humana continues to pay 30% throughout the policy year. It's important to note that all your benefits will begin again each calendar year in January. So for example, let's say you have a 5,000 annual max plan and you use it all up during the year. The next January, that bucket will refill again with an additional $5,000 for the following year, and so on. So every year you'll have more benefits. If you have the unlimited plan, that wouldn't apply because you have unlimited benefits that continue on throughout the years. Humana offers a huge network of providers. Our PPO plans allow you to see any dentist you choose. If you have a dentist that you enjoy working with that's not contracted, you can stay with them. But no, the contracted dentists, is a slight savings to those, but we give you the option and the freedom of a PPO to see whatever dentist you choose.
Well, that's great. Thanks, Regina, for all of that. Now let's get into the meat of the program, the plans and the affordability and what it costs and how and why every member should have this plan. Most people should be going to have their preventative care, which includes office visits, teeth cleanings, maybe gum cleanings, some X-rays. That costs, without a plan, $900 roughly every year. And for you, your spouses, each one is going to the dentist, I hope. But don't forget, you're paying with after-tax dollars, which means that you have to earn roughly $1,200 just to pay that $900 to your dentist. Now, the basic charges are not covered because the fillings and the root canals and the extractions, these are not covered with no plan, obviously, because then again, with also the major charges, you're paying with 100% after-tax dollars. So this is your situation now if you don't have a dental plan. And we hope that every one of you are going to at least get your preventative care work done. Now let's take a look at Humana. If Regina, if you could click on the next, click on the, you'll see that with the preventative care with Humana, if you have the Humana plan with the same charges, the cleanings and the office, $900 worth of charges. If your doctor happens to be in the network of Humana, there will be some discounting involved there as well. But the more important thing is Humana will pay the bill so that you, the patient, have zero costs, net cost zero. Now, what does it cost for this program then? If Humana is offering this plan, there is a cost. The cost is, and you'll see $65 cost there, but this is the unlimited plan. Again, they have many plans, 5,000 maximum plans, 4,000, 3,000, 2,000. So there'll be lower costs as well. I'm showing you the maximum unlimited plan at $795 a year. Don't forget now with this plan, when you buy it through the group, you get to do it with pre-tax dollars. Uncle Sam is really helping you out by almost $196 by doing on a pre-tax basis, so that your net annual costs, drum roll, $589 in this example. I want you to think about or dwell on that for just a minute. Paying $1,200, earning $1,200 and paying your dentist $900, or would you rather pay only $600 with this plan and get coverage for your basic and your major car charges, where you pay 20% for your basic charges, your fillings and gums, and then the major charge you only pay 50%. So now you have a full health plan, dental plan, for less than half of what you already are doing if you're going to the dentist. this is very compelling. This is why I say that every member of the chamber, employer member, and their employees, and the employees should have a oops, that was a Freudian, a Humana PPO dental plan. If you go to the next slide, oh, by the way, if you click on that first, if you're a group of larger than 9 employees, there will be lower. There's actual lower cost for that as well. And these are just ballpark numbers, and the final numbers will be based on actually what your actual business industry is. But these are pretty close. If when you see the final numbers. Let's go on to the next slide. Oh, this is the next slide. So those are the ballpark numbers. Okay, so let's talk about, I put beware at the very top of this. And why? Why do I say that? Because oral health care is so important. It's related to healthcare. I'm posting here 5 different articles from the Heart Association, from the Mayo Clinic. When you click on all these things, you'll see that oral health care is directly related to heart disease, to strokes, to even the risk of death. I mean, this is crazy, right? Most people don't think about that, but if you have bacteria and you have infections in your mouth, it is critical you get those things taken care of right away. In fact, most surgeons now, including Kaiser, because this also just happened with my wife, who just had a knee replacement. One of the very first questions they ask her is, have you gone to the dentist recently? Have you taken care of all your dental problems? And if she said, no, I have a cavity, which I haven't got to yet. Well, we cannot operate on you right now. You need to get that taken care of first. Get your teeth taken care of. If you have infections, if you need a root canal, get it all done so that we don't have to risk any more infections, because we're going to open you up and do our surgery. We don't want any more infections possibly that could cause sepsis, cause death. So another example, it just happened recently, somebody we know had to have a hip replacement, and Kaiser said, well, you have dental problems, so you better take care of that. So he had to go and get that taken care of. Meanwhile, Kaiser said, after you get that dental care, we have to wait another 3 months before we can even operate on you. We want to make sure that your oral health is in order, and so that we can operate. So how important is very important. I mean, just like you do your preventative care for your health, you need to do your oral dental preventative care for your teeth as well, because it's all related. So I guess in summary, for this presentation, the main thing is you saw that without a dental plan or with a dental plan, you see that the cost to enroll into Humana's dental plan is actually less than what you're already doing. And again, increasingly, just so you realize that oral health is so important. Inflammation and all that stuff leads to major issues, all of which can affect your physical performance. I encourage each one of you to get started. Just contact us. And if you click one more time, Regina, there again is really a no-brainer scenario here, because you're already paying for those who are already paying for it. It's just now that you need to enroll. And again, there will be lower pricing for larger groups. And if you really want to have coverage for implants, those are available also for groups of 5 or more. And so at this point, we can open it up for questions. It's very straightforward. I think the key here is you just need to enroll. If you go to the next slide.
There.
And if you click, oh, by the way, those at the bottom of the slide here, you see that there are some links to the medical MERP. We did a quick 5 session with Nick about a month ago about explaining about the medical program that we're offering as well, that can help you save 25 to 20 to 25% on your medical costs and improve the coverage for the employees to be 100%. And the links to hear that audio interview is on Spotify and on Apple. Those are the links to that. Please take time to review that, because again, 25% is a big savings, and 100% coverage for employees is unheard of. If you click one more time, let us help. These are my contact information. Let us help you apply. It's really easy. Humana makes it so easy to enroll into their health dental plans. So if there are any questions, we'd like to entertain and answer those at this time.
Clifford, you had mentioned that you can stay with your current dentist, but that
Yes.
you also get sometimes additional discounts if your dentist is also a provider of Humana. So, but you can keep your dentist regardless.
Yes, you can go to one thing most people I've known is that they do not want to change their dentist. They already know what the pain level is with that dentist, right? So if they are in the network, that's great, because then Humana gets to pay a little less because they have the agree to discount their fees X amount of dollars, which helps with the premium. But if they are not in the network, it just so happens they can also go to that dentist, and just know that whatever Humana pays that dentist maybe not quite enough at, say, preventative care is 100% covered, right? But if that doctor is an expensive doctor for whatever reason, and maybe outside of the usual and customary charge, then there may be what we call a balance due that the patient may still need to pay over and above what Humana is going to pay. Again, we encourage everybody to go to the network. And Regina, if you can tell, I think more than 70% dentists are in the network. So if that's important. The key is you do not need to change.
Right. Okay. Good to know. Plus, some payment is still better than all payment.
Oh, no, exactly. Again, some people, if you go to, like I said, an expensive dentist for whatever reason, you can also nominate that dentist. There's a way to nominate that dentist to get in touch with Humana. Humana can reach out to the dentist, see if they would like to be a member. And that's done all the time as well. So, don't give up if your dentist is not there.
Cool. Okay, we have an audience question.
Yeah. Hello.
I've got, if you hit,
Just a quick question. Is there a waiting period or that you have to wait once you've enrolled, or does it begin immediately?
Yeah, that's a good question. Very, very good question. For those people who do not have a dental plan currently, and they're going to enroll now for the first time with Humana, if the group is more, if the enrolling group has 5 or more enrolling, then there's no waiting period for any of the dental care, dental work. In other words, preventative care, basic and major does not have a waiting period. If it's less than 5 employees, then there is a waiting period for your major work. Your preventative care will be covered immediately, as well as the basic is covered immediately. But you need to wait 1 year. You got to stay in the plan, pay your premiums. It's starting the 2nd year. Then you can go and get your major work done, your crowns and your bridges, your implants and things like that. But for your basic preventative care, no wait.
Okay. Are there any other questions?
I'd just like to thank Clifford and Regina for presenting today on our BizDev workshop series, and just remind our listeners that we will have it posted on our YouTube site for further dissemination of information to your employee base as well. We've had a chance now to work with Geneharmonics and Clifford and his team now for several months, and I guess what I'd like to offer is, you're right, the healthcare expenses on the expense side of any of our employers is not insignificant. So if there's an opportunity to have a conversation to understand the potential to reduce your healthcare expenses, but at the same time potentially increasing the benefits to your employers is certainly worth the conversation. So again, we appreciate Geneharmonics and all the work that you do, both on the medical and the dental plans, and we certainly are offering this to all of our chamber members as well for at least a conversation, which obviously takes place to help tailor the plan according to the employer base. And again, I think I'd like to note that it really, and Clifford, just correct me if I'm wrong, but it really spans everything from a small business owner to a large business owner, depending on the employee base that they have. So it's more than just worth the conversation, because again, understanding how you can increase opportunities as far as benefits is an important from a recruitment and retention perspective, as well as obviously lowering the operating expenses on that part of the P&L obviously is a good thing for all business owners. So just wanted to thank you both for spending some time with us today, and I know you're available as we shoot this podcast, excuse me, not podcast, this series of BizDev workshops out to our community as well.
I'd like to add one more thing, Nick, because since I haven't talked about the employees so much, but the employees, the employer, obviously, when they enroll as a group, but the employees can be given the option to enroll as well. Now, the employer has many ways that it can help the employees. I mean, obviously, they have enough money to pay for the single coverage. That's great, or they can maybe have them split the cost. You know, you pay half, the employer could pay half, the employee could pay half. Again, these are all pre-tax situations. There'll be tax deductions for the employees when they enroll. So it's very flexible as to how much and who can pay and help out this, because we're talking roughly about $50 a month here to have a plan, or even less, down to $25 if you really are tight in budget, and just cover maybe just the basic, maybe the preventative care part of it, and then we can get down to, you know, as low as maybe even $25. So the key here is the employees do not have to pay it all. The employers can participate, and if they do pay it all, at least they have. Now, again, they're also already doing their own preventative work as well, paying with after-tax dollars. So here, again, it behooves them to also enroll and have a full dental plan.
Okay. All right.
I would like to just really quick encourage people, if you found this beneficial, of course, reach out to Clifford and Kim to get started. But if you see the savings that are happening on this dental presentation as beneficial for you and your employees, check out the medical information that we put out on the Quick 5 podcast that Clifford mentioned. It's available on Apple and Spotify and Amazon, actually, under Audible. Just look up Quick 5 with the Morgan Hill Chamber of Commerce, or you can look up those direct links as well, and listen to that, because that's a lot of benefits as well, but just on the medical plan side. So very good.
By the way, on the medical, in one case, we're working with a nonprofit. I know we have many nonprofit members in the chamber. We worked with one nonprofit, and we were able to save them almost 30% on their medical, and it was able then to use that savings to buy a dental plan for the employer, for the employees.
Yeah, I mean, so there's benefit in both.
Yeah, I mean, it's like we got a two from, actually it was more than that. We bought them a long-term disability program. We bought them an accident program through AFLAC. We have so many more benefits for that nonprofit now, just on doing the medical secret sauce MERP.
Well, that's the old adage, it's a cascading effect. So the conversation is the starting point. So again, we encourage our members to be thinking about where they are today with their healthcare expenses, and to give Clifford and his team a call to take a look at how they can customize and tailor a program for everybody.
Thank you all for your time. We look forward to meeting and talking to you. By the way, I'll be at the mixer tonight, which is kind of strange. Something about horses I recall seeing. I'll be at the mixer tonight, and I'll have toothbrushes in hand. I'll be passing out toothbrushes as I talk to people, and hopefully get the ball going on the dental program.
Sounds great. All right. Thank you all.
Thank you, guys.
Bye now.
Bye-bye.